Good afternoon all. Myself Dr. Rupika, currently working as an assistant professor in Sanjeevini Ayurveda Medical College, Hubbali. Today is the fifth day on Astanga Ayurveda And this wonderful session is based on the concept of Balaroga and Prasuti Tantra. Further, we are witnessing this with the most informative lectures which are going to be delivered by Dr. Gourish Asuti and Dr. Shailaja ma'am. I wholeheartedly welcome you, sir and madam, and I would like to welcome all the faculties from the various organizations. So, the first session is going to be presented by Dr. Gourish Asuti, sir. Before that, let me introduce Dr. Gourish Asuti. Sir has completed his undergraduation from Ayurveda Mahavidyalaya, Hubbali in the year 2006. After that, Sir has ranked second rank in the state in the Prasuti Tantra and completed his post graduation from N.K. Jabsheti Ayurveda College in Bidar in the year 2010. Sir also presented papers in many of the international, national and state level seminars and published articles in the journals. He has vast experience in teaching for more than 10 years and he is also recognized with the good clinical practice, and presently he is working as a professor and HOD Department of Prasuti Tantra and Stree Roga at Sanjeevini Ayurveda Medical College, Hubbali. Note for the audience, for the any queries or doubts, please keep your drop your questions at the chat box. We will consider at the time of the panel discussion. Okay, I welcome you, sir.
Guru Nama. Good afternoon, all the delegates present in the webinar. I wholeheartedly thanks to Dr. Bannigoda sir, who is the principal of SAMCH, Sanjeevini Ayurvedic Medical College, Hubbali, for giving me an opportunity to share my knowledge and clinical experience on this platform in Astanga Ayurveda. So, following the footsteps of the Bannigoda sir, I would like to share my knowledge on Prasuti Tantra, which we have tried a clinical trial in our college on the uterine fibroid. So coming to the Astanga Ayurveda, the challenges and treatment outcome of the diseases of Astanga Ayurveda. That is, in 8th branch, one of the branches which is told in the Ayurveda, that is Balaroga. Actually, the exact Prasuti Tantra they have not told, but in Balaroga they have considered about the Prasuti Tantra. So the one quotation is there: Garbhakrama Vijnanam Sutika Upakrama Sada Balanam Roga Shamanam Kriyaha Balachikitsitam. That is in Harita Samhita, in second chapter 17 quotation, he has told about the Garbha means from the conception till the delivery, and he has followed about the Sutika Charya also, and next he has told about the Bala Chikitsa, means the treatment aspect or treatment modalities of the Bala Chikitsa. So considering this quotation, we can tell that in Balaroga they have explained about the Prasuti Tantra. So in Astanga Ayurveda, in one of the Bala Roga, they have explained about the Prasuti Tantra. So coming to the main line of treatment, before going to my subject, I want to dedicate one quotation to the women, because my subject is on Prasuti Tantra. Sanjayate Shutra Shonitam Asyam Sastri. The woman who conceives or who carries the Garbha, that woman is called as a woman, or that woman is called as a Stree. So considering and going my head to the woman, I would like to continue my slides. So today's topic is Ayurvedic management of Garbhashaya Arbuda with special reference to uterine fibroid. So myself, Dr. Gourish, the professor and HOD of the Department of Stree Roga. So coming to the introduction part. So in introduction, first we shall see the incidence of uterine fibroid or Garbhashaya Arbuda in India. So according to one survey, there is around 20 to 40% of women during reproductive life during reproductive life. That is a particular word. That is during reproductive life, they will suffer from Garbhashaya Arbuda. And around 11 to 19% in perimenopausal age, means before going to the menopausal age, she around means 35 to 40 years, that is called as perimenopausal age. At this age, she will be suffering from Garbhashaya Arbuda or uterine fibroid. So considering to the introduction, uterine fibroids are most of the benign one. It is not a malignant one. This is the most of the benign pelvic tumors in women of reproductive age. The effect of 20 to 40% of women are found to be asymptomatic. 20 to 40% of women will be having the uterine fibroid, but they will be not having any symptoms. But when you do the hysterectomy, around 70% of the cases of the hysterectomy done the uterus, you will find the uterine fibroid. Means most of them are asymptomatic one. So some will be having symptoms, some they will have show the symptoms, some will not have show the symptoms. So here asymptomatic is an important topic. So in 70% or 75% of hysterectomy specimens, this is due to fact that most fibroids are asymptomatic. Fibroids can cause high morbidity. That is coming to the clinical apparent is up to 25%. When we consider around 40%, 25% of women will be having the clinical symptoms, whereas another 15 to 20% will not have any clinical symptoms. And it causes a significant morbidity, including prolonged or heavy menstrual bleeding, including with pelvic pressure or pain. So considering all these symptoms, when these symptoms are aggravated, patient will land up to your clinic and or with heavy bleeding or menorrhagia, and we are suggesting or the other gynecologist will be suggesting for go for the hysterectomy. So here our aim is to protect the uterus or to protect the Garbhashaya and to restore the woman's life normal. So considering this one, next we shall move to the next slide. Definition of the uterine fibroid. First we shall see according to the modern aspect what do mean by uterine fibroid. Then we shall move to the Granthi and Arbuda according to Ayurvedic. Coming to the first definition, uterine fibroid or leiomyomas are benign tumors of uterine muscles called myometrium. It is situated in the myometrium. They contain receptors for the female reproductive hormones like estrogen and progesterone. More is estrogen, less is progesterone, and other enzymes receptors related to the estrogen production. Here other enzymes which are there are aromatase receptors, aromatase enzyme or receptors which are highly, if these aromatase receptors are present in the fibroids, that will interfere with the estrogen and progesterone production. So if this aromatase enzyme is present in the fibroid, that will increase the size of the fibroid. So coming to the next point, the cause of the fibroid and the development of the fibroid according to modern aspect, it has not been told that it is not an accurate etiological factor they have not told, but they have put forth some theories that it might be related to the some etiological factors like hormonal influence, hereditary factors, though they have gained attention in recent years, but uncertainly the etiological factor has not been told. So when we don't know the etiological factors, we can't give the treatment. Without knowing the etiological factor, we can't give the treatment. So here basic thing is whenever a patient goes to the other system of medicine, when they see the fibroid or related with the symptoms, they will indicate for the hysterectomy. Compared to the palliative treatment or medical line of treatment, they will directly indicate for the hysterectomy. So here our aim is to restore the normal health and to preserve the uterus. So next we shall see the classification of the uterine fibroids or types of the uterine fibroid. They have told in the modern concept that subserosal, intramural and submucosal. When we see the first type, that is subserosal, the other types are also there that I will tell you that, but considering these are the main three types. First one, subserosal. Subserosal means found superficially, that is in the picture you can see. So subserosal is found superficially under the outer lining of the uterus, that too particularly in the serosal layer. In the serosal layer it will be found, that is in the outer layer of the uterus, you will be finding this one. That is called as subserosal uterine fibroid. Then coming to the second one, this is the most commonest fibroid which we are finding nowadays. When we take 10 patients of the uterine fibroid, around 5 to 6 patients will be suffering from intramural fibroids. This is the most common uterine fibroid. They are situated in the middle layer of the uterine wall. In the middle layer of the uterine wall, in the picture you can see, in the middle layer of the uterine wall it is situated. That is intramural fibroid. Next, coming to the submucosal fibroid. Submucosal fibroid means it will be having the in between the myometrium and endometrial lining. So it is the inner layer of the fibroid, So this submucosal grows in the myometrium near the inner lining of the uterus called endometrium. These are the classifications they have told in modern aspect, or these are the types they have told in the modern aspect. Leaving this one, some of the things you can see in the fibroid, that is pedunculated and other things, which are commonly seen in the ligaments of the uterus. These are the other fibroids which are seen in the ligaments of the uterus are called as the other uncommon one. These are the rare one and these are the uncommon uterine fibroids. Next, moving to the next slide. Symptoms. What type of symptoms they will be facing when they have the, mostly they will be a asymptomatic one, but if the fibroid is in the large size or in the bigger size, then they might suffer with, or the hormonal imbalance is a lot, or the only estrogen level is more and progesterone level is less, then patient will suffer from some symptoms. These symptoms are the common symptoms which will be, they will be presenting when you are in the clinics. They will be presenting these symptoms like menorrhagia, pressure symptoms, secondary dysmenorrhea, subfertility, and dyspareunia. Because subfertility, why I am telling this, concentrating on subfertility, because it is acting, or this fibroid is acting during reproductive life. Reproductive life means she can get conceived, she can delay other things, but due to this fibroid, she will be having repeated abortion, repeated miscarriages, or she can't get conceived. So subfertility is also one of the positive factor or symptoms she will be facing during the fibroid of the uterus. So coming to the first symptom, that is menorrhagia. Menorrhagia means prolonged and heavy bleeding within the normal cycle. If she is having a prolonged and heavy bleeding during the normal cycle, that is called as menorrhagia. Why this happens in the fibroid of uterus only? Why not in the other condition? Because this in other condition also it happens, but commonly it will be occurring in the fibroid uterus. Menorrhagia, this is the most probably, why occurs this menorrhagia? This is most probably due to the expanded surface of the endometrium. So the expanded surface of the endometrium, which is having the endometrial shedding, this is the most positive factor why the patient tells that she will be having the excessive bleeding. Then coming to the second one, subfertility. Subfertility. Why we are concentrating on subfertility? Because in subfertility or in uterine fibroid, the hormonal imbalance will be there. Due to this hormonal imbalance, what happens? The whatever the ovulation is there or the regulation of the cycles will be there, that will be impaired. The regulation of the cycle and ovulation will be in the fibroid uterus. Next, coming to the secondary dysmenorrhea. Secondary dysmenorrhea. You know about the primary dysmenorrhea and secondary dysmenorrhea. Secondary dysmenorrhea is particularly concentrated on the pathological condition of the dysmenorrhea. If any pathological condition involved in the uterus, that leads to the secondary dysmenorrhea. Here the pathological condition is involved is fibroid uterus or fibroid tumor or fibroid uterus. That leads to the secondary dysmenorrhea. Means there will be a painful menstrual cycle. Whenever she gets menstruation, it might be for the 5 days, 6 days, or 8 days, or 10 days. The bleeding, whenever she has the bleeding, she complains of pain. That too particularly in the lower abdominal pain or in the pelvic region. This is the secondary dysmenorrhea. She will be having the symptom. Then coming to the pressure symptoms. What do you mean by this pressure symptoms? The whatever the enlarged fibroid uterus is there, that will be having a pressure over the bowel or bladder. If the pressure is over on the bowel, then she will face with the constipation. If the pressure is over the bladder, then she will be having the frequency of micturition, or in case of fibroid uterus, if it is in bigger in size, repeatedly she will be telling that she want to go for the repeated restroom or bathrooms, because the pressure over the bladder will be there. That leads to the excessive urination, and this leads to the UTIs, that is urinary tract infection, that might be the causative factor. Then coming to the lastly, dyspareunia. If the fibroid uterus or the fibroid which is situated in the cervical region, okay, during coitus, the patient might have the dyspareunia, that is painful intercourse or painful coitus, what we call it as dyspareunia. So if the fibroid is situated in the cervical region or in the lower part of the uterus, that might lead to the dyspareunia, or sometimes it leads to the PID also, that is pelvic inflammatory disease. Sometimes the patient might complain of pelvic inflammatory diseases also. Next, coming to the, when we understand the symptoms, now the main aim is to diagnose the things. Okay, how we can diagnose? By abdominal examination, by speculum examination, by manual palpation, and by USG. The diagnosis is the important criteria for any point of disease. Any disease, if you want to diagnose it, if you are not diagnosing correctly, then the treatment will be wrong. So here diagnosis as a important in the fibroid uterus. So how we can diagnose it? The common thing, whatever now we are doing, without doing any examination, we are sending for the ultrasonography of the abdomen and pelvis. But without, if in the rural area, if you are not having the ultrasonography, or if they want to go to the urban area, then with the abdominal examination, speculum examination, or by manual palpation also you can diagnose it as, you can diagnose it, and you can send for the sonography, so that you will be have the clear picture, whatever you have the knowledge, you can interpret in that one. So coming to the diagnosis, first abdominal examination. When you do the abdominal examination, so how we can do the abdominal examination? Patient should lie in the supine position, flex her knees, and palpate below the umbilicus. You should palpate below the umbilicus with your four fingers. With your four fingers below the umbilicus, because as you know, the uterus is a pelvic organ. Uterus is a pelvic organ, and normally it is not felt, or you can't feel on palpation. If it has any abnormalities, then only you will be felt by your fingers. So when you palpate below the umbilicus with your four fingers, pressure in lower abdomen, if you are feeling, or till she tells she has pain, that much you can put the pressure over the lower abdomen. When you feel the fundus of the uterus or the part of the uterus, if you can see the things, if any lump is there or anything hard substance is there, it is a mobile or it is having the consistency, then you can think that there is a pedunculated uterine fibroid or subserosal uterine fibroid, because it is lying in the outer layer of the lining of the uterus. So coming to the next, speculum examination. In speculum examination, it should be done with the sim speculum or anterior vaginal wall speculum, anterior wall vaginal wall retractor. With these two instruments, we should do the speculum examination, or we can use Cusco speculum also. So when you see what is importance of doing the speculum examination in uterine fibroid, if the fibroid is situated in the cervical part or in the lower part of the uterus, then what happens? There will be a pressure over the cervix. There will be a pressure over the cervix. Usually, when you do the vaginal examination, there will be a you can see the cervix in the midline of the vaginal wall. But due to pressure, it will be deviated. The cervix will be deviated to the left fornix or right fornix because of pressure over the cervix. Otherwise, it will be in the midline of the vaginal wall. So this thing we can guess that something pressure is there, or another thing what happens in the when you do the speculum examination, there might be a shortening of the cervix might be there. Why this shortening of the cervix? Because the whatever the pressure is there, there will be traction will be there on the cervix, and it will be pulled off. It will be pulled off. So the cervix becomes shortened. In speculum examination, we can diagnose like that. And when coming to the bimanual palpation, you can see in the picture. You can see in the picture how we should do the bimanual palpation. Usually, all the gynecologists will be knowing this one, but the many students are there in this one. So I am telling that how we should do the bimanual palpation. Bimanual palpation means two fingers should be inserted per vaginally, of the right hand. If you are a right-handed person, you can introduce two fingers in the right, two fingers in the upper vaginal, and with the left hand should be palpated in the lower pelvic area, so that we will get the consistency in between our two fingers and with the left hand. When we feel this one, what we are diagnosing here, if it is hard or any lump is palpated here, if any lump is palpated, try to assess the uterine shape. You can assess the shape of the uterus. You can assess the lump. It is a movable or it is a hard, or the consistency or the length of the fibroid you can assess. It is very broad or it is a small or it is a movable or it is a immovable. By doing this one, we can tell that by manual palpation we can diagnose this one. Then coming to the lastly, USG. In USG, ultrasonography, what we call it as ultrasonography of the abdomen and pelvis. We are doing in abdomen and pelvis because the uterus is a pelvic organ, so we always write abdomen and pelvis in the USG scan report. So we can do for abdominally also, we can go with the TVS also, that is transvaginal sonography, what we call it as TVS. So in TVS, when we do, it is vaginal and abdominal probe will be there to assess the uterine size. Why we are doing ultrasonography? To assess the uterine size, number of the fibroids, size of the fibroids, and the location of the fibroid will be diagnosed in the ultrasonography. Whereas in the abdominal examination, spectral examination, or bimanual palpation, we will be knowing only the fibroid might be present or lump is there. But in USG, we will be diagnosing what is the number of fibroids, what is the size of the fibroid, and where the actual, it is a subserosal, submucosal, or intramural fibroid, or it is a pedunculated one, or the unknown, what we have told, the rare one. So in USG, we will be getting this one. And what is the importance of this one? This important is to decide we should go with the myomectomy surgery or we should go with the total hysterectomy, or hysterectomy means the laparotomy. By doing the laparotomy, we will be removing the uterus, that is called as hysterectomy, or myomectomy. Only the part of the myomectomy or the fibroid part is removed and we have saved the uterus. So this is the deciding one when you do the USG. These are the diagnosis factors. Next, coming to the investigation. When you do the investigations, CBC. Why we do the CBC? That is complete blood count, what we call it as. So in complete blood count, we rule out the HB level, that is hemoglobin level, because the patient complains of menorrhagia, means she will be having continuously bleeding. She might have the anemia. So to rule out the anemia or to know the hemoglobin level, we are doing the CBC. And another condition is to rule out the ESR and the WBC. If raised ESR and raised WBC is there, then we should think as it is an infected one. Okay, it is an infected, or some of the infection might be involved in the fibroid uterus. So to rule out all these things, we are doing the complete blood count. Then coming to the blood grouping. Why we should do blood grouping? If the patient is suffering from anemia, severe anemia, we call it as severe, moderate, and mild anemia. So in severe case of anemia, when the patient hemoglobin is in between 6 to 7, we want to transfuse, the blood transfusion should be done. To do the blood transfusion, we should know the RS typing and the blood grouping. So what type of blood group she has, to arrange the prior to the operative or post operative, we should see this one. Then coming to the urine analysis. Why we should do the urine analysis? Pre-operative and post-operative, patient should not suffer from any type of UTIs. Pre-operative and post-operative, patient should not suffer from UTIs. So we are doing the urine analysis. Next, coming to the SIHS, that is saline infusion hysterosalpingography. Hysterosonography, saline infusion hysterosonography. What it means? So we are inducing the saline inside the uterus, so it gets distended. When it gets distended of the uterine cavity, will help you to see the fibroid. It is a pedunculated one, or in which cavity it is present inside the uterus. In which cavity? That is, it is a subserosal or it is a submural or it is a intramural. To know this one, we are doing this. This is rarely we are doing it, but we are doing with USG only. We are diagnosing it. And another one is HSG, that is hysterosalpingography. What is the importance of this hysterosalpingography? Why we are doing this hysterosalpingography? So why we are doing this hysterosalpingography is done in that tubal patency test. Okay, it is done for the tubal patency. What is the importance of this HSG in this one? This importance of HSG in this fibroid uterus. So once again, in fibroid uterus, that is, if patient is having any type of fibroid in intramural, that too particularly in the fundal area, it might, if the intramural fibroid in the fundal area, it is in the bigger type, that might block the cornea of the fallopian tube. That might block the cornea of the fallopian tube, so that whenever she want to get pregnancy, the sperm will not enter inside the fallopian tube because of this fibroid. So whatever in HSG, what we are doing, a Conray dye we are pushing in the HSG. When this dye spills out through the fimbria, we will be telling that okay, the tubes are patent. But in this case, what happens that the Conray dye or the dye which we are using, it will not fill out. It will be blocked inside the uterus only. By X-ray or by scan, we will come to know. So this suggests that for this reason, any tubal block is there or no in the intramural fibroid. To rule out this one, we are doing the HSG. Then last one is hysteroscopy. What is the investigation? This hysteroscopy that is called as HSC. HSC. It is very useful for assessing the intramural or submucosal fibroid by introducing a scope with a camera into the uterus. With a camera, we will be introducing this one. In sometimes with hysteroscopy only, if the we are doing some smaller mammectomy also with this hysteroscopy. Not only the diagnosing point of view, we are doing some treatment line of treatment also when we are doing the hysteroscopy. These are the some investigations which are done to rule out the uterine fibroid or Garbhashaya Arbuda. Then coming to the line of treatment according to the modern aspect. There are three lines of treatment which has been told in modern system, that is expectant management, medical treatment and surgical treatment. The expectant management means here we are not treating anything. We are just looking forward, means what is the size of the fibroid, it is consistent or it is going to increase. So what do you mean by this one? The treatment is in expectant management. The woman with asymptomatic, means in asymptomatic woman, fibroids should only be monitored. If she doesn't have any symptoms like menorrhagia, dyspareunia, or pressure pain symptoms, nothing like that, but if she is the asymptomatic one, then should be monitored. It is important to explain to the patient that what she has, means you should explain her what she is having. It is a harmless one. This fibroid is a harmless one, but it is not giving any problem to you. Means it is a asymptomatic one, it is not giving problem. But in future, means every 6 months or once in a year, she should go for the monitored for the ultrasonography. Why? Because the size of the fibroid, whatever it is there, it has been increased or still it is a constant one. Means if it is increasing, then we should go for the surgical treatment. Otherwise, it is not needed. So coming to the sometimes fast growing fibroid could be sarcomas also. Sometimes if you live like that only in expectant management, sometimes it leads to the sarcomas of the uterus. When you suspect a sarcoma, the patient needs a hysterectomy. If you are suspecting that a patient gone into the sarcoma level, then she needs to the hysterectomy. Then coming to the medical line of treatment, what is the medical line of treatment? Here the hormonal imbalance will be there, and particularly we are concentrating on the hormonal balance. So what happens here by medical treatment? Here the symptoms are only reduced, but the fibroid uterus will not be reduced in the size. Okay. Whenever you see the medical line of treatment in other system of medicine, the only the symptoms, whatever she is having the symptoms like menorrhagia. Menorrhagia is a prime symptom in fibroid. If the continuous menorrhagia will be there, then patient will end up to anemia and ultimately the death will occur. So what happens in medical line of treatment? They are concentrating only on the symptom wise based. It might reoccur after a few days. If you give some medicines, it will be subsided for a few months. Once again, it might occur, that menorrhagia. So here the concentration on the medical line of treatment is only on the hormonal pills or hormonal injection or hormonal implants or some IUDs like intrauterine devices we call it. So here to treat symptoms only by hormonal treatment, the hormonal treatment available at present helps to stop or decrease only the symptoms like menorrhagia. Progesterone shows a several effect in reducing the menorrhagia. Only the progesterone, whatever we are giving, that will reduce only the symptoms, but not the reduce the size. So the endometrium becomes flat. When you give the progesterone, it becomes flat. The endometrium becomes flat and inactive. Thus reduces the amount of the menorrhagia symptom. So some medicines which are available in the market like Depo-Provera or Marina or Norplants like implants like Norplants or LNG IUD, that is levonorgestrone IUD, that is intrauterine device. When you give this IUD inside the vaginal wall through the cervix, so it will cause the amenorrhea, but it will not reduces the size of the uterus. So this is the modern aspect of the uterine fibroid. Next, going to the Ayurvedic perspective or Ayurvedic view of the Garbhashaya Arbuda or Garbhashaya Granthi, whatever we call it as. So the Granthi, the advanced age is called as, the advanced formation of the tumor is called as Arbuda. So coming to the Ayurvedic management or Ayurvedic view of the Granthi or Arbuda. So Granthi and Arbuda is a disease characterized by the growth or a mass of the mamsa. Okay, it is growth or a tumor or a fibroid which is grown by developing by the mamsa dushti. So developing in any body parts, it might develop in any body part. If it is developed in the breast, we call it as breast neoplasm or fibroadenoma. If it is developed in the cervical region, it is called as cervical. It is called as cervical tumor. If it is occurring in the uterus, then we call it as cervical uterine fibroid. So any body parts it might get it. Stimulating the description of tumor. Granthi means knotty, elevated, and hard mass will be there. Granthi means it is a hard and elevated one. Different diseases conditions like Granthi, Arbuda, allergy, Vidradi, Apache, having a common features of Shota. So these all things are explained in the Shota Chikitsa or Shota concept. They have explained all these things in the Shota. So this allergy, Apache, Vidradi, and Granthi and Arbuda all come under the Shota. Shota means Utseda are basically considered under the Shota. Utseda means elevated part. In Granthi or in Arbuda, it is elevated. What we can call it as capsulated or uncapsulated form of the tumor is called as Arbuda or Granthi. Then coming to the Shopa. Shopa is defined as an elevation caused by doshas localized to a particular thing, particular organ or generalized one. So, and situated between the Twak and Mamsa. This Shopa is situated in between the Twak and Mamsa. So, this is the explanation of Granthi. So, when we consider the types of Granthis, there are all the acharyas, they have considered 5 types of Granthis, that is Vataja, Pittaja, Kapaja, Mejaja and Shiraja. But when we consider with Charaka aspect, he tells that the 6th one is Mamsaja one. According to Charaka, the 6th Granthi is Mamsaja Granthi. And another aspect, the other aspect according to Vagbata, what he is telling, totally there are 9 types of Granthis that including all these things, Raktaja, Astija and Vranaja are the other types of Granthis. Totally they have told in classes that is 9 types of Granthis. So in all classes, they have accepted that 5 types of granthis are there. When we considering with the Dalana aspect in the Sushruta, what he is telling, the 6th type of granthi is Raktaja and Mamsaja. The 6th type is considered as Raktaja and Mamsaja. So this type of granthis they have told. Next, moving to the next slide, that is types of, or moving to the Arbuda. In the context of Arbuda, what do you mean by Arbuda? Arbam himse tasmin uditi. Arbam himse tasmin udati. That is in Shabda Kalpadruvam. Shabda Kalpadruvam, he has told about the definition of Arbuda, which causes the himsa to the body. Which causes the himsa to the body, that is called as Arbuda. Arbuda. That is, himsa means what? Harm, injury or killing. Harm, injury or killing, which causes the pain to the body is called as Arbuda. So in Shabda Kalpadruvam, he has told. Another context they have told that Arbuda Budanti. Arbuda Budanti. Budanti means elevated part, or it is elevated or growing. Fast growing. Fast growing is called as Budanti. Means it pursues very fast, or it increases in the fast. The growth of the Arbuda will be fast. So coming to the types of the Arbuda, what they are telling, or coming to the Nidana. Before going to the types of the Arbuda, we will see the Nidana of the and the Samprapti of the Arbuda. So Vegadharana, if a lady is doing the Vegadharana or jumping, or obstruction of the blood vessels in the, and any ulcer, any type of ulcer in the uterus or in the cervix, if it is have the blockage of the blood vessels, then she will suffer from Arbuda, what they are telling. And mamsa vitiated due to the consumption of diet, means mamsena mamsa vardate. What we are telling, mamsena mamsa vardate, means this type, what we have seen the clinically, who are non-vegetarians are more prone for this Arbuda, because mamsena mamsa vardate. This, the who are eating the mamsa, they will suffer from Arbuda, what they are telling. So in Ayurvedic concept, they are telling that the consumption of the vitiated mamsa or increase in the mamsa leads to the formation of tumor. And other aspect they have told, any impact to the wood by wood, any injury by the wood, stone, weapon or any iron implants is the positive factor for the formation of Arbuda. Then coming to the Samprapti of the Arbuda, the aggravated doshas, particularly here Kapha Vata or Vata Kapha doshas will be aggravated. This vitiates the mamsa, then getting localized to the any part of the body. It might be the breast, it might be the cervix, or it might be the uterus. Any part of the body, it will get localized. Then produces a local swelling and accumulation of the mamsa. At that place, it gets accumulated and formation of the mamsa will be there. And that leads to the, and it enters in the deeper muscles, round, fixed, and it becomes big. It becomes round, big, and fixed in that particular area. That increases gradually and never separates. And it will never separates, means that granthi or mamsa or arbuda, whatever it is there, it will never get separated, means it will never get infected one, but it will be there. Okay. Then this is called as granthi or arbuda. In this samprapti, particularly in Shushruta, Nidanasthana, 11th chapter, 13th and 14th quotation, he has explained about nicely about the arbuda samprapti. Then coming to the Dalana, the commentator of the Shushruta tells that granthi develops due to the mamsa and rakta. This granthi is developed due to the mamsa and grantha, and arbuda is an advanced condition of the granthi. Okay, what he is telling, the Arbuda is an advanced condition of the Granthi, but it is particularly formed by the Mamsa and Rakta. Then coming to the Arbuda is magnified form from the Granthi. This is the magnified form of the Granthi. Then coming to the types of the Arbuda, Vataja, Pittaja, Kapaja, Shiraja, Mamsaja, and Medaja, Arbuda they are telling. So in class 6 they have mentioned 6 types of Arbuda. Then coming to the Samprapti Gatakas of the Arbuda, because here Samprapti Vigatana Meva Chikitsa, what we are telling, okay, Samprapti Vigatana Meva Chikitsa, that is, if without knowing the Samprapti Gatakas or Samprapti of any disease, we are not able to treat the disease. So here Samprapti Vigatana is the main line of treatment in uterine fibroid or Garbhashaya Arbuda. So the Samprapti Gatakas are doshas which are involved here is Vata and Kapha, some part of Pitta also. So here Vata and Kapha is the main dominant, particularly when we consider the Vata is Apana Vata, because Apana Apanaga Shroni Pasti Mitra Ura Gochara Shakrut Mutta Garbha Nishkramat Kriya is telling, means whatever it is there in Garbha. Garbha means Garbhashaya, whatever he is telling that Garbhashaya, the Apanavata, if it is not functioning normally, it is affected, then it is having the problem. Particularly Vata, when we consider Apanavata is Dushti. And Kapha, here Kledaka Kapha is having the problem, the doshas. Then coming to the doshas, here dosha is Mamsa, Medha and Rakta dosha will be there. And Sthana, Gatra Pradesha Pachideve, means Gatra Pradesha, wherever it is getting accumulated, it might be a breast or it might be a uterus, wherever it gets the accumulated, there the formation of tumor or there the formation of fibroid. If it is situated in the breast, we call it as fibroidenoma. If it is situated in the uterus, we call it as uterine fibroid. If it is situated in the cervix, we call it as cervical cyst or Bartholian cyst. So wherever it situated, that is called as Sthana, that is Gatra Pradesha Pachideve. Then coming to the Shrotas, which are the Shrotas involved here? Shrotas is Mamsava Shrotas, Vedava Shrotas and Raktava Shrotas. But some special Shrotas are involved in the Samprapti Gataka, that is Artava Shrotas in uterine and cervical neoplasms. The Artava Shrotas is involved. And if there is a fibroadenoma or lump in the breast, there might be Kshiravahadamanis. Kshiravahadamanis is situated. Then coming to the Shroto Vikara, the Shroto Vikara is Shiraha Granthi. Arbuda has been described widely, but there is no special reference of genital tract Arbuda. There is no explanation. They have explained widely about Arbuda, but they have not explained about the genital tract Arbudas or Granthis. So when we consider on the basis of specific clinical features of Mamsaja Arbuda, as well as description of Arbuda in general, it can be said that all the relative big neoplasms developing from the muscular or fibrous tissue like myomas or fibromas come under the Mamsaja Arbuda. That is in Shushruta Nidhanasthana, the 11th chapter 17th quotation. When we consider that quotation, we can tell that whatever the Mamsaja Arbuda Shushruta is telling, that we can consider. It might be localized to the breast or it might be localized to the abdomen or uterus. That we can consider as the genital tract. The breast, then we call it as breast means Stana Arbuda. So wherever it is situated, that we can name it. So here the mainly in Mamsaja Arbuda, the Kapha and Vata accumulation is the main positive factor. Coming to the Chikitsa aspect of Arbuda and Granthi. The Granthi and Arbuda Samprapti is same, Chikitsa is same. So the Aushadha Chikitsa, what we are dealing with is Stanika and Sarvodehika Chikitsa can be done. Or in Shalya, if you are going with Shalya Karma, then Chedana, Vedana and Lekana we can do it. And if you want to go with Anushastra Chikitsa, then we can go with Chara, Rakta Mokshana and Agni Karma. Okay. Then coming to the next point, the case study, whatever we have done, the clinical trials in our hospital, that the case studies I want to discuss, because without knowing the who is having a regular cycles but prolonged menstrual bleeding was there, that is particularly menorrhagia. She was complaining of abdominal pain and painful heavy menstrual bleeding since 1 year. Means she was having regular cycle, but she was having a prolonged cycle. That leads to the emaciation of the patient. Means she was suffering with anemia. Anemia means she was having the moderate type of anemia. Means in between 8 to 9 grams of HB was there. 8.5 exactly. 8.5 gram of HB was there. So then what we have decided, okay, we should go with the USG. We have done the bimanual examination, then we have not got any relevant thing. Then we have suggested her to go for the USG, that is ultrasonography, was carried out on 3rd July. Immediately when she came to the 2nd July, we have told her to go for the scan in the 3rd July. So that time she has reported with the uterine fibroid. When she has reported the uterine fibroid, she came to us and we have convinced her what are the line of treatment. But she was not convinced for that one. Then she has approached to the modern gynecologist and she was advised to the hysterectomy because the size of the fibroid and seeing the condition of the patient, they have decided to go for the hysterectomy. Then she denied for the hysterectomy and she came back to us once again on the 4th July. So she came back 3rd July she came, and when we convinced her, she went on that day only to the other gynecologist. He has not convinced and say I have to go for the hysterectomy. Then she denied for the hysterectomy. She came back once again on the 4th July. So this is the report what we have seen. On 3rd July, report reads antevoted normal in size, shape and echo structure measuring 7.9 into 4 into 4.8 centimeter. A small hypoechoic lesion in the posterior wall of the uterus measuring about 1.5 into 1 centimeter. Means a small cyst was fibroid was there. That too particularly small posterior wall intramural fibroid. You can see by the side there is a picture of the scan report. So small posterior wall intramural fibroid was there. Then we have seen this report, and we have planned a line of treatment for this fibroid. So what the medical intervention we have planned? So we have, because we want to reduce our symptoms and we want to treat the fibroid, both the things we want to do it. So we have selected Ashoka Arista, we have selected Varunadi Kashaya, we have selected Kanchanara Gugulu. That too particularly double strength tablet we have selected. Because Ashoka Arista does the Ashoka, what is the importance of this Ashoka Arista? That I will tell in further slides. So Ashoka Arista we have given 10 ml BD after food, Varunadi Kashaya 10 ml BD before food, and Kanchanara Gugulu, that is double strength 1 BD after food. It was scheduled for 3 months with follow-up of once in a 15 days. What are the subjective and objective criteria before and after we are seeing? Subjective and objective criteria before and after we are seeing. So here the subjective criteria were menorrhagia, duration of the menstrual cycle, and she was feeling weakness and fatigue. So before treatment she was having 7 to 8 days. Sometimes she was telling 7 to 10 days also. The present at when she came to our OPD, she told about 7 to 8 days. Okay. When in next cycle she told about 7 to 10 days. The present was 7 to 8 days and fatigue was present. But after treatment, the menorrhagia was absent, means her cycle was 3 to 4 days, regular cycles, and the fatigue was absent because she, whatever the anemia was there, that has been controlled by the medicines. Okay, then coming to the objective criteria, the size of the uterus before and after treatment, you can see. The before treatment I have shown you. After treatment, it was the same as it is. Okay, slightly 0.1 of the size has been increased and decreased. But the size of the fibroid in ultrasonography, before it was 1.5 centimeter into 1 centimeter. When we have done the after treatment, it was resolved. There was no any hypoic lesion or any fibroid inside the uterus. The timeline was around 3 months, 3.5 months, 3 months. That is, she came to us in the July, and when we have done the report in October, it was resolved. The fibroid uterus, whatever it was there, it was been resolved. The 15th October report, you can see antevoted normal in size, antevoted uterus normal in size, shape and echo structure measuring 8 into 4.3 into 5 centimeter, and this particularly no space occupying lesion we are seeing. So you can see in the uterus, by the side of picture, you can see there is no space occupying lesion they have given. So, and impression they have given that no obvious abnormality. Till now she is under my follow-up and she is having the regular bleeding and she doesn't have any complaints or any. The follow-up scan has been done a few days back, that I have not put it, but the scan doesn't show the same report it is showing. No obvious abnormality is seen. So this is the how the wonderful our treatment or the things whatever we are giving in Ayurveda. The modern aspect, it is concentrating only on the symptoms based, whereas Ayurveda we have resolved the fibroid and we have reduced the symptoms also. Coming to the discussion, the treatment is based on the Karyakarana Siddhanta. Here the treatment is based on the Karyakarana Siddhanta and Samprapti Vigatana Meva Chikitsa. The Samprapti whatever we are having, the Samprapti Vigatana and Karyakarana Siddhanta, on this both principles of the Ayurveda, we have treated the patient. That prime treatment was aimed at reduction of symptoms of menorrhagia as well as treating the fibroid. It is based upon the Ayurvedic principles of Karya Karana Bhava, that is, Karya Karana Bhava is cause and effect theory, cause and effect theory. When the effect is treated, it should have an impact on its causative factor also. When you are treating the effect of that one, there will be effect on the causative factors also. The main doshas involved in this is Vata and Kapha. The main doshas which are involved in this one is Vata and Kapha. So the Vata and Kapha, which the increased Vata causes impaired ovarian hormone secretion, which is third causes creation of Vaigunyata in the Garbhashaya, means makes the Garbhashaya susceptible for the Garbhashaya Arbuda. Due to the Vaigunyata of this one, this forms the Arbuda. Increased Vata causes the vitiation of Kapha, leads to the Shrota Avarodha and formation of the Granthi and Arbuda. Again, vitiated Vata enhances at the rate of cell division, results in the formation of Garbhashaya Arbuda. So, coming to this discussion, when we see the Ashoka Arishta, why we have selected the Ashoka Arishta, Varanadi Kashaya and Kanchanara, Ashoka mainly contains the tannins, saponins and beta estriol. What all these things, tannins, saponins and beta estriol, it exhibits antioxidant, hepatoprotective and anti-inflammatory activities of Ashoka Arishta, essentially needed for the management of menorrhagia. We need all these things to the control of the symptom of menorrhagia, hence indicated in the uterine bleeding. Whenever there is a excessive bleeding, we always prefer Ashoka Arishta. The bark of the Ashoka contains phenol glycoside, which has the direct effect on the uterine musculature. It stimulates both endometrium and ovarian tissue. It decreases blood flow and tones of the endometrial vasculature and thus checks the excessive bleeding. So it controls the excessive bleeding. Whatever she was telling that she is having the menorrhagia, that has been controlled by Ashoka Arishta. Then coming to the Kanchanara, here the Kapha Jushti should be resolved. The Kapha Jushti, whatever it leads to the manifestation of the enlarged lymph nodes, cyst or growth, the Kanchanara Gugulu is very useful in the extra growth or tumors and helps in the reducing the bleeding also. So administration in the cyst, malignant ulcer, syphilis, fistula or sarcophala, this our sinuses. Sarcophala is nothing but the lymphadenitis of the tuberculosis lymphadenitis of the cervical tuberculous lymphadenitis is called as sarcophala. If you are trying this in the lymphadenitis of the tumor, we can use Kanchanara Gugulu also. In lymphadenitis or any increase in the lymph nodes, we can treat, we can give the Kanchanara Gugulu. Coming to the Varanadi Kashaya, traditionally used for this treatment of obesity, atherosclerosis, fatty liver disease, tumors and chronic arthritis. So when we see the indication of the Varanadi Kashaya, a research work is done on the Varanadi Kashaya, one survey has done and the research work has done. What is the action of Varanadi Kashaya? In this one, they have told that in tumors also we can use the Varanadi Kashaya. Keeping in this mind, we have used the Varanadi Kashaya. The adipose tissue infiltrated monocytes will differentiate into the inflammatory macrophages and release pro-inflammatory cytokines such as TNF, alpha and IL beta. On this TNF also it is acting. So keeping in this mind, when this Arbuda reaches in the malignant stage, that time also we can use the Varanadi Kashaya. Therefore, in present study, it acts on the tumor. Coming to the conclusion, last part of the session, conclusion. Surgical intervention need not to be the only option for the uterine fibroids. Means whenever a patient comes to you with a uterine fibroid, you should not tell her to go directly for the hysterectomy. You should make her convince her for the uterine fibroid can be resolved by the Ayurvedic line of treatment, and you can tell her. Then logical Ayurvedic intervention can be the better option. Means the Karakarana Siddhanta or Samprapti Vigatana Miva Chikitsa. That is, if the patient is lean, we can't use the Kshara Karma or Kshara Dravyas. If the patient is obese, we can use the Kshara because the long duration of the Kshara cannot be used. The short duration, around 45 days maximum, we can use the Ksharavati. So if the patient is obese, you can treat with Ksharavati, then you can go with the same line of treatment. With this one, you can add the Ksharavati also. So logical Ayurvedic intervention can be the better option. it not only relieves the symptoms but also restores the normal life of the woman. We are not concentrating only on the symptoms. We are concentrating on the symptoms and to reduce the fibroid of the uterus. So avoid further complication. Two means it doesn't go to the other complications like dyspareunia or pressure symptoms or whatever the other symptoms, not only for the menorrhagia, it will doesn't go for the further complications also. With a key point, I would like to end up my session that what is the scope of Ayurveda in the neoplasms? What is the scope of Ayurveda in the neoplasms? First is prevention of the carcinoma. Here, prevention of the carcinoma by Swastharutta, Rasayana and Ojo Vardaka Dravyas. Second one, detection of carcinomatous condition. Pre-carcinomatous condition, before only if you have detected, then with Ayurveda also you can treat it. But the condition should be there, the staging should be done of the carcinoma, CA of the cervix or CA of the uterus, whatever it is there, you should see the staging of the carcinoma, then you can treat them. And Grantihara, Shotahara, Rasayana and Ojovardhaka Chikitsa in a pre-carcinomatous changes can be done. If the line of treatment should be the Shotahara, Grantihara and Rasayana and Ojovardhaka Dravyas, if you do, then you can restore the life of the woman. And lastly, Rasayana and Ojovardhaka Chikitsa in operated chikitsa. If patient has come to you after the hysterectomy or after the Arbuda chikitsa or after the she has detected the carcinoma, then after the operation also you can give the Rasayana and Ojovardhaka Dravyas. So with concluding these points, I would like to end up my session, and I am very much thankful to the Astanga Ayurveda organizing committee members, that is particularly Shashikant and Santosh Bhushat, and for the organizing such a nice Astanga Ayurveda webinar on in the pandemic corona. So coming to the, I thank Dr. Principal, Dr. S.K. Banigol sir, for giving me an opportunity on this platform and sharing my knowledge, the clinical aspect of this treatment, whatever we have done. Thank you one and all.
Thank you, sir. Thank you for sharing your document-based clinical study on Arbuda, and your work will helpful for the upcoming clinicians. Thank you so much, sir. So now we will start with the next session, and it's my pleasure to introduce and welcome Dr. Shailaja. The ma'am has completed her undergraduation from the Ayurveda Mahavidyalaya Hubbali in the year 1992 from the Karnataka University, and post-graduation in the Koumarabritya from the Sri Dharmasthara Manjunatheshwara College of Ayurveda and Hospital, Hassan in the year 2003. Ma'am has completed her doctorate from the Rajasthan Ayurveda University, Jodhpur in the year 2009, and she has published about 104 papers in various national and international journals. She has presented more than 58 papers in different national and international seminars, and she has been a principal investigator for 10 research projects funded by various funding agencies such as CCRIS, Government of Karnataka, RGHS, etc. She was still continuing as the investigator for the major research projects on cerebral palsy and Swarnaprashana, sponsored by the Rajiv Gandhi University of Health Sciences, Bangalore. Currently, ma'am is working as a professor and head department of Koumarabritya at Sri Dharmasthara Manjunatheshwaram College of Ayurveda and Hospital, Hassan. And she is a BOS member of IRGHS for the third time, and she is serving as the faculty member in IMS BHU. With this brief introduction, I welcome you, ma'am.
No, you can speak now. Your voice is So, namaste, but slide is not properly showing. I think from here. Can you please activate sharing option for us so that we will only share the slide?
Okay, madam.
Okay.
Just a minute.
1 minute. Huh?
Ma'am, we try to share, madam. We have assigned for all the participants.
Okay.
This sharing option is not activated still.
Sharing is not still activated.
Okay.
Now try, madam.
Now you can try.
Okay. But still it is not.
It is not coming.
Still it is not coming.
This sharing option is not coming for us. It is not activated.
Just
1 minute.
Where's-
You're working on that.
Okay.
now, madam. Now we can.
Now it's
Okay, by that I will. Okay. At the outset, I congratulate the Sanjeevini Ayurveda Medical College and Hospital for conducting such a wonderful webinar on Astanga Ayurveda. So, on behalf of this webinar, once again, for giving me opportunity, I thank the organizers, mainly my teacher, principal of the college, Dr. Bannigod sir, for giving me the opportunity. And I am also witnessed the presentation of Dr. Gourish sir, and it was a very nice presentation on fibroid uterus. So, coming to my presentation, actually it is on Astanga Ayurveda, no? So, we know in Astanga Ayurveda, Kaya Bala Grahordvanga, Shalya Damstra Jarabrashan, and second one is Bala Chikisa, or Bala Chikisa is also called as Koumarabritya, and under Koumarabritya itself, as Gourish sir told, Koumarabritya is in Sahita, it is told that, okay, so it's not coming.
Sir, can you only please share the PPT, sir, because we are not getting those option of sharing.
Okay,
You can share.
so as it is, you only start sharing,
Okay.
and I will tell that next slide. I think I have to do that.
Okay.
So as under Koumarabritya, the Prasuti is also included. Garbhopakrama Vijnanam, Sutikopakramasthata, Balanam Chikissa.
This slide
It's
is
not coming properly.
It is coming upside down.
Or otherwise, you make us to
Share. Because
share.
we are
Otherwise,
not,
we are also not able to do, and you are also not.
they are seeing.
So, Garbhopakrama Vijnanam, Sutikopakramasthata, Balanam. So, under that,
Now, can you please share the slides first? Now you can.
no.
No. It is not. It is still coming. The meeting
Madam,
time.
madam, we have given you a privilege of hosting. So now everything is under your control. You can share, madam.
But it is.
You are a host now. You are a host.
So, but I will check once
It will not come and they
whether it's coming. You are able to observe it?
No, madam, not yet, madam, not yet.
Not yet. And you need to give me the option there.
You are a host, madam. You are a host now. All the options are with you only.
But it is. I'm not able to do it from here.
we are not able to do from here.
Just a minute, madam.
We got it.
Now we got.
Okay.
Whether it is possible?
Not yet, madam, not yet.
Not yet.
Ah,
Huh. Is it okay now?
yes, madam. Okay.
Okay. So my topic is actually Panchakarma in Bala. So as it is the means one among the Astanga. So before starting my actual presentation, that is Bala Panchakarma, I want to introduce you to the Koumarabritya. So my first slide is on introduction of Koumarabritya. So as we all know, Koumarabrityam nama Kumarabharanam Datrik Shira Dosha Samshodhanartham Dustastanya Samuttanam cha Vyadhinam Upashamanartham cha. So mainly in Koumarabritya, so we need to take care of the baby from birth to 16 years. But if you observe the definition of Harita, even another definition of Sushruta, if you observe also, there it is mentioned that even for the purpose of healthy progeny, we need to treat the mother. So mother before her conception, when she is young, so yoni vyapathi is also included. So in this one, in the definition of Harita, it is told, no, Garbhopakrama Vidyanam, Sudikopakramasthata. So Koumarabritya means under that the Prasuti, Stree roga, Prasuti and Koumarabritya was there. So let it be. Now the Koumarabritya is mainly after birth up to 16 years. So in that also, if you observe the definition of Sushruta, so Koumarabharana means just like the definition of Ayurveda. Swastasya swastya rakshanam, or aim of Ayurveda. Swastasya swastya rakshanam, aturasya vikaropashamanam. Same way, in Koumarabritya also, the definition of Koumarabritya, Koumarabharana is one part, and next part is Datrik Shira Dosha Samshodhanartham Dustastanya Samuttanam cha Vyadhinam Upashamanartham cha. So Koumarabharana is taking care of the growth and development of the baby, or taking care of the health of the baby, or taking care of the swasthya of the baby. Swastasya swasthya rakshana. The Kumaras Bharana. Kumaras Bharana means Palana Poshana. And next portion comes as Datrik Shira Dosha Samshodhanartham Dustastanya Graha Samuttanam cha Vyadhinam Upashamanartham. If you observe this definition, lot of importance is given for Bala. Bala means from birth up to 1 year, that is infant. So Datrik Shira Dosha Samshodhanartham. So now it is the means this 1 week is breastfeeding week celebration, World Breastfeeding Week celebration. So if you observe here in the definition, Datrik Shira Dosha Samshodhanartham, Dustastanya, twice it is mentioned the importance of breast milk here. So we need to take care that qualitatively, quantitatively, the breast milk should be very superior. Then the health of the child will be very good. Baby's health and later child's health, later adult's health also. So the foundation of our health will be in the Balya period. That is Balya period means, or Bala period, that is in infancy from birth to 1 year. Once again, if you observe, that is Graha Samuttanam cha Vyadhinam. These Graha Samuttanam cha Vyadhinam, we can understand it as many infectious disorders. They are also attacking the baby during Balavastha, infancy and toddler life. That is why young age is given more importance in Koumarabritya. And otherwise, up to 16 years, whatever the diseases comes, that is also managed. And once again, as I come to my topic, that is mainly Bala Panchakarma. So here if you observe the definition of Balam or Bala, Tatra Balam Aparipakva Dhatuhu, Ajata Vyanjanam Sukumaram Akreshasaham Asampurna Balam Shleshma Dhatu Prayaha Ashodasha Varshat. So mainly if you observe here, the Bala is with the Aparipakva Dhatu and he is Sukumara, he is Akleshasaha, that means the tissues are not yet completely developed And the differentiation, Ajata Vyanjana, we can understand it as a differentiation is yet to develop, and systems and all yet to develop completely. And they are very delicate. Sukumara and they are Akleshasa also, they are tender and delicate, and their immune status is also not completely developed, Asampurna Balam. And they are mainly with the kapha in their body. That is Shleshma Dhatu Prayaha. That is why if you observe immunity, that is Bala. Mainly for Bala also, Shleshma is very much important. Kapha itself is considered as a Shleshma, or the Kapha itself is considered as a Bala, or for the Ojas also, Kapha is very much important. That is why it is the stage of Kapha, that is why growth and development is also happening. But because of the aparipakvata of the Dhatu, Sukumaratva, Aklesha Sahatva, and Asampurna Balatva, the treatments like Shodhana, whether we can go for in children or not, that is the question. For that purpose only, my presentation today in front of you. So once again in Charaka Sahita, it is mentioned that Nivrattir Vamanadinam Mradutvam Paratantratam. Because of the Paratantratva, because of the Mradutva, we should not go for the Vamanadi Panchakarmas or Vamanadi Shodhana Karmas. That way the Charaka is explained about the management of the children. Means we should not go for the Tikshna Shodhanas, Nivrattir Vamanadinam, mainly because of the Mradutva and Paratantrata and Vakcheshtayo Rasamartyam. And these children are mainly younger children. Means Paratantra Bala is having the difficulty of Vakcheshtayo Rasamartha. Means Vak means they are not able to speak properly. That is why understanding them, and they will be not able to tell whatever the problems they are getting. That is why conduction of Panchakarma or Shodhana Prakriyas are difficult. That way Charaka explained. But in pediatric age group, we need to be very careful. We need to take the precautions properly, and certain modification may be required, but we can conduct Panchakarma even in children. So that how that one I will be going to share with you in my presentation later. And once again, as I told, Paratantra Bala, Vamanadi Karma is little bit difficult, but still we do it. And there, along with the Panchakarma, we can go with the Shamana Chikitsa. Mradu Panchakarma, we can go with the Shamana Chikitsa. And even though the Swatantra Bala is advised to go for the Panchakarma or Shodhana Prakriya, but in Kashyapa Chikitsa, Fakka Chikitsa, you can understand that in Fakka Roga, Kashyapa mentioned that you need to go for the Virechana there. Kalyanakam Pibet Fakkam Shatphalam Va Yatamratam Saptaratrat Param Chainam Tribrat Kshirena Shodayet. And you know, Fakka Roga is even after completion of 1 year, the child is not able to walk. Vakcheshtayo Rasamartya is the main problem in case of Fakka Roga, or main clinical presentation in case of Fakka Roga. But in that disease itself, the Shodhana, Trivrat Kshirena Shodayet, that is mentioned, and that too classical one. Means for 7 days, the patient needs to undergo Snehapana, and after that, the child needs to undergo the Virechana with the Trivrat Kshira. That itself shows that even Paratantra Bala also, we can go with the Shodhana Prakriya. So let us see. Mainly, as I told, in case of children, we need to go with the Shamana Chikitsa and the Shodhana Chikitsa. In my this presentation, I will be emphasizing, giving emphasis on the Panchakarma. Not only Shodhana Chikitsa, even as the Shamana Chikitsa. Let us see. In case of, in my presentation, even though it is mentioned as the Panchakarma or Shodhana Chikitsa, many of the Chikitsas are even Shamana Chikitsas also. Under Purva Karma, many the practices comes that we can understand them as Bahya Chikitsas comes, that we can understand as a Shamana Chikitsa. They are not the Panchakarma, or they are not the Shodhana Chikitsas, but usually we call them as we consider them under the Panchakarma. They are actually not Shodhana Prakriyas. let us see one by one how the Purva Karma, how the Pradhana Karma, how the Paschat Karma is important in managing different conditions of pediatric patients or pediatric clients. When we consider Purva Karma, under Purva Karma, Rukshana, Snehana, Svedana, these things comes as a Purva Karma of Pradhana Karma. Maybe Vamana, Virechana and Bastis. Mainly in Vamana, Virechana, we need to consider these things. And other than that also, with this Purva Karma only, I am discussing as Purva Karma as a prior to Shodhana, and these Purva Karmas or these Karmas as a Pradhana Karma also. That way I will be discussing with you in further presentations. So Rukshana, Bahya and Abhyantara, Sneha also Bahya and Abhyantara, and even Svedana also we can consider Bahya and Abhyantara. But how the Abhyantara Svedana I will discuss while presenting. So let us start with the Rukshana. So first, mainly in Rukshana, Abhyantara Rukshana, let us discuss first. Mainly for the purpose of Rukshana. Why this Rukshana is required? When the patient comes to us, they may be with, usually we treat the children, one who is with the Bahudosha Avastha and one who is with the Chirakalina Vyadhi. In such condition, we go for this Shodhana therapies. Otherwise, we go with the Shamana Chikitsa only. In chronic case, Bahudosha Avastha is if the doshas are in excess, and Chirakalina Vyadhi means chronic diseases. It may be chronic respiratory disorders, or it may be chronic skin conditions, or it may be developmental disabilities. In such condition, it may be sometimes apasmara or even unmada, ADHD, autism. This all we can consider unmada. So in such all condition, as they are chronic diseases and they will be with the Bahudosha Avastha, then we have to go for Shodhana Chikitsa. And in such conditions, there will be formation of ama in them. Their Agni is Manda. That is why what we need to do first is we need to go for Deepana Pachana. Or Abhyantara Deepana Pachana, Chitrakadi Vati, Hingvastaka Churna or Hingvastaka Vati, Panchakola Fanta or Trikatu Churna or Agni Tundi Vati. These things we can give. Or simple Shunti Kashaya also we can give. And let us see a case of for explaining this Deepana Pachana, how we do it. Recently, a case with maybe 10-15 days back only, which was admitted in our hospital. A 12 years old male child, it was having belching, burning sensation in the chest and pain, abdomen was there. And he was also with the irregular bowel habit. He was sometimes loose stool was there and sometimes constipation. That means Apana Vata Vikrati was there. And even Pitta Vikrati was also there. That is why with this we diagnosed him as Adhogata Amla Pitta, and he was associated with Agni Mandya too, and the tongue was coated. So he was given with the Deepana Pachana for 3 days with the Chitrakadi Vati and Panchakola Fanta, and after that we started with the Snehapana, and then later Virechana was done for him. So that way, in this case, the 3 days the Deepana Pachana was done. If the patient is not with much ama and if the tongue coating is not there, 1 day of Deepana Pachana may be sufficient. That is why we need to understand the patients properly. Then we need to go for the Deepana Pachana and Bahya Rukshana also. So Bahya Rukshana, when we consider, if the patient got admitted in hospital for the purpose of the Shodhana, first 1 day or 2 days or 3 days, depending on the condition what we discussed before. Deepana Pachana was given for 3 days, that 3 days also he was underwent even the Udvartana. So Udvartana is the one of the Bahya Rukshana procedure. And this Udvartana not only done before this Snehapana as a Purva Karma, and even sometimes we do it as a Pradhana Karma. Along with Udvartana, we may be giving some Niruha Basti. There it may not be exactly Pradhana Karma, but it will be helping Pradhana Karma, that is Niruha Basti or Astapana Basti. So indication for Udvartana, Staulya if the staulia is associated with hypothyroidism, or it may be in cases of PCOD, younger means adolescents with the PCOD. There also we can advise the Udvartana, maybe with the Niruhabastis. Kapha Meda vitiation condition, if it is, Avarana is there, or Kapha Vata Pradhana conditions, there also we advise the Udvartana. And even in cases of the Down syndrome, or in cases of hypotonic CP, such cases also we advise Udvartana as one of the treatment procedure. So importance, or a case I want to show, discuss with you, is a child of 5 years. The child is associated with delayed milestones, and he was having tightness of bilateral lower limb. The diagnosis was made as a spastic diplegia or spastic diplegic cerebral palsy, and in him what we observed is there was kapha vata pradhanyata, which was giving rise to that spasticity, means stambhata and gauravata. To reduce that, the patient was given with the Udvartana before Yoga Basti. So after this Deepana, Pachana and Rukshana, then we have to go for Snehapana in case of, or Snehana in case, mainly if it is for the purpose of Shodhana, we need to go for the Snehana. Once again, here Bahya Sneha and Abhyantara Sneha is there. Here Abhyantara Sneha is done first, and then Bahya Sneha will be done. So let us see about the Abhyantara Sneha, how we can go for, and what are the difficulties there with doing Snehapana in cases of children, and how it is managed. So when we considered Abhyantara Snehana, that is Snehapana, as a Purva Karma of Vamana or Virechana, then once again, it may be of two types. It may be Acha Snehapana or Vicharana Snehapana. So in children, we usually think that Acha Snehapana is very difficult. But in my experience, we do almost all Acha Snehapana only. Very rarely we go for Vicharana Snehapana. Because in case of Vicharana Snehapana, what happens? The quantity will be increasing. So in such cases, the child may not be liking. So Acha Snehapana is the best one. When the child is not at all ready to take the Acha Snehapana, it is not at all ready, means because of the smell and all, the child is hesitating a lot and getting vomiting also. In such cases only we have to go for the Vicharana Sneha. So Acha Snehapana means we need to start with the 30 ml, or depending on the condition, we need to select the Sneha, and then we need to go with the Arohana Krama, 30 ml, 60 ml, 120 ml, depending on the Agni. That we need to, based on the Kosta and Agni, we need to decide the dosage of next day's Snehapana. So we need to ask how much time it is taken for digestion of the 30 ml of Snehapana by the child that day, and by that next day's dosage is decided, and total how much, that one is also decided by the first day Snehapana, how much it took for the digestion. So for that some modification also we can do, because in children they may not like the more quantity of the Sneha to take. In such condition, what we can advise is taking of some jaggery or sugar along with that, a bite of jaggery and then Sneha, like that. But still what I practice is during Snehapana, so before starting Snehapana, I will tell them to relax, and some these pranayama practices with the soothing music. By that the child will be little hypnotized. Then he will be not able to understand the smell of the grata, or he is not much with the smell of the grata. He or she easily takes the grata. So within few minutes, the child or the girl or boy will take the Sneha. Otherwise, usually when we give this Acha Sneha, they will take lot of time. That is not good for the giving of Snehapana. It's better within short time they have to take. So once again, Vicharana Sneha, sometimes we go for when the child is not at all take, or it is getting some vomiting sensation or like that, then we go with the milkshake or kesari bath, or sometimes with the basti. So here one case, in that case we adopted all, that is first day we did the Acha Snehapana, and then second day we did the Vicharana Sneha, and third day he was not at all ready even for the Vicharana Sneha. then we went with the Basti. So how it is done? So that child was with Shwitra, and first day 30 ml of Acha Snehapana was given, and the second day he was not ready to take the 60 ml of Snehapana, and he vomited. Actually he took, but immediately he vomited. That is why after little time we gave him Vicharana Sneha, that is 10 gram of Tila plus 70 ml of Kshira and 10 ml of Guda with the 60 ml of Grata. The milkshake was made and it was given. And that child received the, that day he received. But next day he is not at all ready to take even Vicharana Sneha. That is why he was given with the 90 ml of Sneha in Basti form. So morning 30 ml, afternoon 30 ml, night 30 ml. Because if we give more Sneha in Basti, that will come out immediately. So we divided the dosage of that day Snehapana into 3 times. After food it was given, morning after breakfast, afternoon after lunch, and in night after dinner. The Snehapana is the Sneha is divided 30, 30, 30, and it was given. And later Vishramakala was done, and then Virechana was given. So these are all the how we can decide the Snehas in different conditions. In skin disorders, Mahatikta Grata, Panchatikta Gugulu Grata, Patoladi Grata, depending on the condition. In dry skin condition, we may advise Mahatikta Grata. And in cases of, if it is obesity like condition, if it is a wet condition, means Vicharchika like condition, there Panchatikta Gugulugrata or Gugulutikta Grata we can advise. And in case of the skin condition, we may go with the Patolati Grata. And in GIT disorder, if it is of the Grahani like condition, there we may go with the Dadimadi Grata. And in cases if it is, the child is with the constipation or Vibandha, there we go with the Sukumaragrata. So depending on the condition, we need to decide the Grata which we have to go for Snehapana. So neurological condition, it may be Gugulutikta Grata, Vidharyadi Grata, Panchakavya Grata, Kalyanaka Grata. In cases of Apasmara, usually we may take Panchagavya Grata or Kalyanaka Grata, and sometimes even Brahmi Grata also. And in cases of the Apasmara, sometimes even we can advise the Ashwagandha Grata for the Snehapana. So we need to understand the patient's condition properly, and proper Sneha should be adopted for the Snehapana. So respiratory disorder, it may be as Sukumara Grata or it may be Vidharyadi Grata. In case if the mainly Tamakashwasa, Vata Pradhana Tamakashwasa, we can go with the Vidharyadi Grata or Dadimadi Grata for Snehapana. If it is of Kapha Pradhana, then we can go with the Kantakari Grata or Indukantam Grata. So we need to understand the patient's condition properly, and we need to select the Grata for Snehapana. And after this Deepana, Pachana, and then Snehapana, then we have to go for Bahya Sneha in Vishramakala. So Abhyanga we need to adopt. For general Abhyanga, we can adopt, it may be done with the Tila Taila or Ashwagandha Balalakshadi Taila, or it may be Chandana Balalakshadi Taila, etc. But once again, according to the condition, for respiratory condition, we may be selecting Asana Bilvadi Taila, Esti Madhu Taila, or Murchita Taila, or even you can select the Marichadi Taila also in cases of the respiratory conditions. Kaphajakasa condition, you can even select the Marichadi Taila also, and sometimes the Karpuradi Taila also may help. And Brahat Saindabadi Taila may be in cases of Tamakashwasa, where the kapha is means Utkalesha kapha is there. If we want to take out the Utkalesha kapha, if we want to go for Sadhya Omana, before that we can do the Abhyanga with Brahat Saindabadi Taila with the Saindava. So in cases of skin manifestation, Shwitra, Marichadi Taila or Somaraji Taila, Eka Kushta, Kitipa Kushta, there Parantyadi Taila or Nalpamaradi Taila we can use, or even Jivantyadi Yamak also, because it is a dry condition, Vata Pradhana, Vata Pitta but Vata Pradhana. So the Parantyadi Taila, Nalpamaradi Taila or Jivantyadi Taila we can advise. In Charmadala, once again, So if it is of dry charmadala, so dry vichachika type of charmadala, there Nalpamaradi Taila, Jivantyadi Yamaka or Esti Madhu Taila. If it is of wet, then Marichadi Taila or Esti Madhu Taila we can advise. And Vipadika, Jivantyadi Yamaka and Esti Madhu Taila. Once again, Vipadika is Vata, Pitta, Pradhana, Tvakvikara. And Shita Pitta, we can go with the Nalpamaradi Taila or Esti Madhu Taila. And in case of Dadru, Dadru is, we know, it is chakra or it is mainly the fungal infection. That the Chakramarda Taila or Iladi Taila we can use. And even Dardura Patradi Taila also we can use in case of Dadru, mainly for the head or otherwise in other part of the body also. In Darunaka, mainly Dardura Patradi Taila is helping a lot. In CNS condition, once again, Ardita, Karpasatyadi Taila we can use, Mahanarana Taila also we can use, Pakshagata, Kshirabala Taila, Mahanarana Taila, Dhanvantaram Taila we can use. If it is a case of Pangu, Kanja, that means spastic diplegia type of cases, we can use Sahacharadi Taila or Prasarani Taila. Prasarani Taila is very much important in Pangu, Kanja cases. And Arspasi, we can use the Ashwagandha Balalakshadi Taila. In cerebral palsy, once again, the Pangu Kanja may be part of this cerebral palsy also. So, Prasarani Taila, Mahamasha Taila, Mahanarana Taila, depending on the patient's spasticity or hypotonicity, we need to decide the Taila here. In case of hypotonicity, we can select Mahamasha Taila there. Mamsagata Vata, mainly it is not Mamsagata. Mamsavaha Sroto Vikara, that means Duchenne's dystrophy. In such cases, we can use Mahamasha Taila. And in Down syndrome, once again, we can use Brahmi Taila or Mahamasha Taila, depending on the child's condition. If hypotonicity is there, Mahamasha Taila we can use. And the skin condition is there, Nalpamaradi Taila or Brahmi Taila we can use. And ADHD autism condition, Brahmi Taila we can use. So next comes the Svedana. So Svedana with a case presentation I want to discuss. Once again, Svedana, if it is for the purpose of the Vishramakala for the preparation Purva Karma, if we are doing, then we go with the Nadi Sveta. Otherwise, if it is a helpful as a Pradhana or supporting Pradhana Karma, then a few case scenario I am showing you and what we are adopting that I am going to show you. So a 2-year child, female child, which was with the dryness all over the body since the age of her 7 months. The patient's condition was, it was very dry body and hair fall was there, and there was very less hair on the scalp and eyebrows also. That the child was using, mainly the parents were using this moisturizer and all almost per day around 13 to 14 times a day. Means about within half an hour the drying of the body was happening. 13 to 14 times they were using the moisturizers. And when they came to me, I diagnosed the case as Charmadala at the age of 2 years, and I started treating her, and I was given the baby with the Abhyanga, Shashtika Shalipinda Sveda, and Mata Basti with Mahatiktaka Grata, and application with Mahatiktaka Dilepa. Here I advised her Shashtika Shalipinda Sveda. Okay, so Shashtika Shalipinda Sveda, for that preparation of milk and rice, I used Bala Mula Kashaya. And initially I used Panchavalkala Kashaya Churna for preparing that. But with that it was increased, dryness was increased. Then I changed it to Bala Mula and Estimodo. I got very good result in her case. And now the child is not having any dryness, and the discoloration which was there, it was totally many area it was black, and the baby's skin was so dry, and now she's completely all right. And per day 1 or 2 times she's applying the Mahatiktaka Lepa as she was applying before 12 or 13 or 14 times. Now it is reduced to 1 or 2 times. You can observe how she it is not the what you are observing is not exactly beginning, it was in between. It was very much intensive dryness and very sparred hair was there in the scalp. Shashtika Shalipinda Sveda you are observing. So that's how one case, and these are all the other variants of Sveda. Mainly Pinda Sveda also we use a lot in children. So Churna Pinda Sveda we use, Kukutanda Pinda Sveda we use, and Masha Pinda Sveda also we use, other than Shashtika Shali Pinda Sveda. So this is another way of Svedana in children, that is Parisheka with the Parisheka Vidu. So a child of 3-year-old, who is diagnosed as spastic quadriplegia and who was not able to walk and stand. In him, mainly in cases of the quadriplegic type of cerebral palsy and even spastic diplegia type of cerebral palsy, we advise the Parisheka with the Dashamula Kashaya with maybe Yoga Basti, etc. So, and the third case is where we give the Nadi Sveda along with the Nagavalli Patraswara. So as I told, in cases of Tamakashwasa condition, so mainly to reduce the kapha there, and also to relieve the whatever the spasm there, the Abhyanga to the Ura Pradesha, and after that giving of Nadi Sveda with Nagavalli Patra is helping a lot. So in case of Tamakashwasa. So another, this one, Svedana, which is what we do in our institution, is Salavana Upanaha, that is done for the mainly to reduce the spasticity in children. So you can observe a case here, 5-year-old male baby, and which was not able to stand, walk without support, and the diagnosis was done as a spastic diplegia, or that condition we did all the other measures along with that Salavana Upanaha. We have done many researches on that, dissertation work, and even we got a project on this, and it is giving a very good result. Salavana Upanaha Sveda with other treatments, Parisheka, Shirodhara, Matra Basti, and Salavana Upanaha. And in case of hypotonicity, Bala, Rasna, Ashwagandha, Mashak, and any Taila use. This is how the preparation of Upanaha, you can observe how it is done. What are all the materials required for the Upanaha, and Churna you can observe, and with that Churna, preparation of Lepa, and that lepa the affected part, and then the coconut, or not coconut, the banana leaf is made into soft, and then that is applied. Over that the Pora cloth or bandage cloth is applied, and it, their main thing is we need to leg or the extremities in proper position, and that should be for that purpose. Sometimes we even require some support also. With that, it helps to reduce the spasticity, and also that helps in making the child's what you can the Vaikalyata will be there, no? That will help in correcting and reducing the spasticity and even reducing the contraction. So with these Purva Karma, now I am with the Pradhana Karma. So Vamana, so you can observe a child here who is drinking before, and for Akanta Purna, we can advise milk, or we can even advise the Ikshurasa, and we can even advise and after that we need to go with the Manaushada. So mainly when we come to Vamana, so it may be Sadhya Vamana or it may be classical Vamana. So in cases of Samakashwasa, if the Utkalesha Kapha is there, and in case of Kaphajakasa, if the Utkalesha Kapha is there, then we can go with the Sadhya Vamana. And even in Shita Pitta case, Shita Pitta case, if the Kapha Utkalesha is there, itching is very much, intensive itching is there because of the Utkaleshita Kapha, the acute condition of Shita Pitta. There we can go with the Sadhya Vamana. Tamakashwasa with Utkaleshita Kapha, Kaphajakasa with Utkaleshita Kapha, and in case of Shita Pitta where the intensive itching is there, and he is with Utkleshita Kapha, there Sadhya Vamana, and other cases of like Shita Pitta, if it is not Utkleshita Kapha is there, Staulya, Chitra, Adogatamla Pitta, Amashejanya Krimi, and Shwasa. In such condition, we know, even though Tamaka Shwasa, Tamaketu Virachanam, but if the Kapha Pradhanata is there, then we have to go first Vamana, then we have to go with the Virachana. So here you can observe a case of Tamaka Shwasa who is undergone Sadhya Vamana. So you can observe that she was with the Utkalesha of Kapha. She was, there was the difficulty for breathing, and she was using the accessory muscles for breathing, and coarse crepitation was there. That was showing that she was with the lot of Utkleshita Kapha. So we diagnosed her as acute or Tamaka Shwasa with the Prabhuta Kapha or Utkleshita Kapha, and she was planned for the Sadhya Vamana. So another case of recently, means last month only, we admitted this case. Her name was Priya, and her age was 8 years, and her this one was TSH was 35.4. She was not investigated before. Recently, we only diagnosed her as hypothyroidism. She was with the neck swelling, and when we sent her for a thyroid function test, TSH was 35.4. Then we planned Vamana. For that purpose, initially Snehapana was done with Indukantam Grata, 30 ml, 60 ml, 90 ml, 120 ml. Arohana, Snehapana was given, and after that the Abhyanga was done, and then Vamana was done with the Madana Faladi Yoga. The totally it was 6 gram, and the total Vegas what we got is the 9, that is Avara 2, Madhyama 4 and Pravara. You can observe that even in this COVID condition, we are taking cases, and that too typical cases like hypothyroidism and many. So this is one case. She is not Priya, she is Yanika, and another case is of Priya. I think her case is also I am going to present later. So she is also taking treatment under, and in her case the TSH is more than 150. So this is Yanika, you are observing now. In this all condition, we are going with the Virechana, Tamaka Shwasa, Tundikeri, Mukapaka, Amla Pitta, Krimi, Pitta Jashirashula, mesenteric lymphadenitis, Kamala, Pandu, Ekakusta, Kitipakusta, Udarda, Shita Pitta, Kota, Vipadika, Charmadala, Apasmara, Unmada. These are all few examples. In many chronic conditions, we go with the Virechana. So here one case, as I told, no, the Priya, she is of 10 years and she was with hypothyroidism since last 2 years, and she was taking Thyronam 50 mcg, and with that also her TSH was more than 150 micro international unit per ml, and for her what we advised, for her we planned for Virechana only, but as it was, she was with little swelling and little this, the exophthalmos was also there. By observing those all things, there was little Utkleshita Kapha. That is why I planned initially with the Sadhya Vamana, and after Sadhya Vamana, she was given with the Virechana later. After Snehapana and all, she was given with the Virechana. And she got 13 Vegas. You can observe. So her case sheet also, admission sheet also. So 22/6/2020 she was admitted, and 2 days back she came. Now her TSH is 56. So it was more than 150 before treatment. Now her within 1 month of treatment, means after this Vamana and Virechana, and she is continued with the Thyronam. Now it became 56, TSH became 56 within 1 month of treatment. You can understand how much the Panchakarma is helping. After Shodhana, 1 week of the Ishrama, 1 week of this one Paschat Karma was done, and another 15 days what I have given her was Dashamula Kashaya and the Dashamula Kashaya and Haritaki Kanda, only 2 medicine, Haritaki Kanda and Dashamula Kashaya, along with the Thyronam. The one more than 150 micro international unit of ml, per ml is reduced to 55 now, 56 now. So she is Priya. She is taking Virachan Aushadha. You can observe it. So then comes the Basti. So once again, in many cases we advise Basti. As we all know, Basti is the Amrita for treating children, and even Charaka says that Ardha Chikitsa is Basti. That is why in many cases, almost more than 50% of the cases, developmental disabilities and all, we treat them with the Basti. So Sarvanga Roga, Ekanga Roga, Vak Sanga, Balakshaya, Dhatukshaya, Admana, Krimi Jwara, Nirama, Atisara, so Andhra Bhujana, etc. condition, we advise Basti. So here 2 examples are there. So 3-year child with the dry cough, not only such developmental cases, even in cases of Vataja Kasa-like condition, when the child is not ready to go for Snehapana and Virachan, etc., then as in Astanga, it is advised, no, if Virachana in children is difficult, then we can go with the Yoga Basti, or we can go with the Astapana Basti. With that principle, in this case, Kasa case, we did the Shodhana with the Niruha Basti or Kashaya Basti. In that, Niruha Basti was given with the Dashamuladi Kashaya, 60 ml of the Dashamuladi Kashaya, and Anvasana Basti with the Kantakari Grata. In Niruha Basti, the Kashaya and Grata. So, alternative day, one day, so first day we need to go with the Anuvasana, then alternatively we need to go with the Niruha and Anuvasana, and last 2 days we have to go with the Anuvasana once again. So second case here is again muscular dystrophy case. You can observe here in muscular dystrophy and Down syndrome and all, even cerebral palsy case, if the child is with the less strength or less bala, there we advise the Mustadi Rajayapana Basti. So Mustadi Rajayapana Basti is said to be the best treatment even for the Sukumaras, and Rajas used to get when they were traveling in Ratha. Yukta Ratha Basti or Yapana Basti. Yapana means traveling. So even during traveling also that can be advised. No, that is why in Sukumaras also it is advised. So developmental disability cases and muscular dystrophy cases, we use this Mustadi Rajayapana Basti. Another case, so recently admitted, her name is Sanvi. So she is with, you see, in July only, this patient, 2 times she got admitted. Now also she is in IPD. So after this admission, now also she came for admission once again. So 5-year child with the incontinency of urine and altered gait since age, and she is having a history of paraspinal abscess, and when the abscess was there, the ascending infection took place, and because of that she developed ventriculitis, and she also developed the hydrocephalus, and she was underwent the surgery, and the abscess was they did the surgery for the abscess, and the surgery was also done for hydrocephalus. She is with the ventricular peritoneal shunt, and with this treatment there is around 20% of improvement in her incontinence of urine and the aggregate, and even sensation of the lower limb is also reduced. That one is also improving. So you can observe girl Sanvi. She is with the 18 kgs weight and her age is 5 years. Not 18, I think 24 kg. You can observe that she is little obese because she is with the hydrocephalus and her movement is restricted because of the one limb, the sensation loss and dragging. So this is the plan of treatment in her case. Abhyanga with Mahanarana Taila, Parisheka with Dashamula Kashaya, and Yoga Basti. You can see here Dashamula and Asanadi Kashaya. As she is with the incontinency of urine, Asanadi Kashaya is selected, and Dashamula also. So both are working for the purpose of reducing that incontinency. Asanadi Kashaya is indicated in case of Prameha, and Dashamula Kashaya is indicated in case of the Shota. So to take care of both, here we combine this Dashamula and Asanadi Kashaya, and Anvasya Basti is given with the Indukantam Grata. Next comes the Nasya Karma. So you can observe here a child of 9 years, one who got the deviation of the mouth. The diagnosis is done as Ardita, or it was a case of facial palsy, and Mukhabhyaga was done with Karpasastya Detaila, and Kshiraduma is given and for the Svedana purpose, and then the Marshanasya is done with the Kshiravalattaila, 10 drops each, and this patient got complete relief after the 10 days. 7 days treatment was given, and after 3 days of the first the complete relief was observed the patient. Next case, once again, other than these Panchakarmas, even Rakta Mokshana is also considered under Panchakarma only by Sushruta. So in cases of Shvitra or in any cases of skin diseases of Sthanika, there we advise Rakta Mokshana. You can observe that a 6-year child with the Shvitra, the Rakta Mokshana is done with the Jalavkavacharana, and that helped. The region was reddish in color, so the Rakta Dhatu, the environment was more, so the treatment of choice we selected here as a Rakta Mokshana. So this is about the Panchakarma in children, and when we do Panchakarma, we have to give importance for the Paschat Karma too. So in Paschat Karma, mainly Samsarjana Krama, we use Ganji, Rava Ganji, Ragi Ganji, Kichidi, Pangal, rice, rasam, etc. Mainly, we need to observe how many times the child passed, means Vamana happened or Virechana. So whether it is Avara, Madhyama or Pravara, depending on that, based on the Shuddhi, we need to decide the Samsarjana Krama. How many days? It is 3 days, 5 days or 7 days. So these are all the do's and don'ts for Basti and Nasya. So light diet and Ushna Upachara, and don'ts are Viruddha Ahara, traveling, and cold drinks, curd. So Rakta Mokshana, mainly avoid hot fermentation over the site and avoid curd intake. So this is how the Panchakarmas are done, or Shodhana Chikitsas are done in case of different cases, and you can observe that in this, what cases I presented, these all are of last 2-3 months, that is during the COVID-19 condition. So that many of us are thinking how the Panchakarma is done during this COVID condition. But in our institution, from our Department of Koumarabritya, Department of Ayurveda Pediatrics, we are doing all Panchakarma procedures depending on the conditions of the children. With this, I conclude my presentation. I thank the organizers for giving me opportunity, and for the purpose of sharing of knowledge, for the purpose of motivating, and also if any questions are there, if the organizers give permission, I am able to answer also. I think the time is already it is 5. If the questions are there, I think you can share with me, and I'll be answering later.
Okay. So
Shailaja, Madam, Namaste.
Namaste.
Madam, this is Dr. Sapna, Professor from Sushruta Ayurvedic Medical College, Bangalore.
Okay.
Madam, I don't have a doubts, but a wonderful, excellent session. Of course, even Dr. Srinivas Barnigol sir's session was also too good. But the Panchakarma, I was, until now at least, just as a RSBK professor, I was just practicing only the Nasya Karma. That too maybe only Prativarsha.
Okay.
But the way you gave the lecture today was marvelous and amazing.
Okay, lot of things were there, and my the limitation of time was there. That is why I was, I think, a little far.
No, madam, it was simply great. I think the ATM machine also may not give the notes in such an excellent way, in a continuous way, but you did it. I took a permission from my college meeting was there actually, but I took a permission, and I think I would definitely like to share all these slides and your knowledge to our Koumarabritya department staff also. And yeah, really
that
good
is
set of
what my this one also. These whatever the message, whatever my presentation is for purpose of motivating all. So Ayurveda needs to spread all over, and
exactly.
Karma should be practiced by mainly one who is specialist. So that is why I think my presentation served the purpose.
Exactly, ma'am. Exactly. That's what I am telling. So I took a permission and I have taken the slides, but I will definitely render all these to our Komara department and Panchakarma
Thank you,
department.
Swapna.
Later, any cases, definitely we will contact you for your help. And
okay, definitely. I will be with you, Swapna, and not only with you, with all who wants my help. I am always ready to help.
Thank you, ma'am. Thank you, and also thank you for the organizers, and thank you, Dr. Srinivas Barnigol sir, also, ma'am. Thank you so much. Namaste.
Thank you, ma'am. Thank you so much for your wonderful review. And it's not an easy thing to perform a Shodhana Karma in the children age group. And Madam has given the detailed idea how to perform the Panchakarma procedures and how to how to convince the children to perform the Shodhana Karmas, and also which Shodhana Karmas we have to perform and their limitations and their criteria. And Madam has given the vast detail in a clear way. Thank you so much, ma'am. Thank you for the wonderful session, ma'am. Thank you so much.
Thank you very much for the organizers, mainly Dr. Barnigol sir.
Thank you, ma'am. Thank you, Shalvi.
Okay. Thank you.
Okay, so there are so many questions regarding the first session, which is performed by the Dr. Gourish Asuti.